Do you want me to come over?
Well, we're going to wait a few more minutes for people to still gather here. So if you're calling in from Zoom, welcome. This will be our U-TuRN Engaged Scholar session for February here, and we're going to wait a few more minutes for people to come. I think some people are still traveling in and trickling in, so hang on there. Thanks. You guys don't have to be quiet now.
Yeah.
Well, I mean, it's when there's all the answers. The elusive. Yes. Well, it's your safer service.
All right, again, we'll get started. My name is Greg Welk, and I'm pleased to have you guys here for our first of our spring Engaged Scholar lectures. It's kind of odd to call this a spring time semester, but this is spring semester. And we'll have 3 Engaged Scholar meetings, and we're really excited to offer these this year because it's really getting to the point where we've envisioned U-TuRN going all along. And so by that I mean that we're going to be exhibiting like some of the collaborations that we have going on with community partners and how it's starting to synergize across different projects within U-TuRN and how we're building towards several different types of grants. And so the theme of these 3 Engaged Scholar sessions this spring are on 3 different partnerships or sets of partnerships that all will work through our different teams. So as the screen cycling, you can see what U-TuRN does. We're trying to enable healthy lifestyles, we're supporting translational scholarship teaching and outreach, and we're facilitating campus community partnerships by linking researchers to stakeholders. And we're doing all of those things. And so we have 4 main interdisciplinary teams that kind of work through the transdisciplinary hub. So I'm going to have Quinn click and show these are the 4 different teams. But now click on Team 2, I guess. So today we'll be highlighting the collaborations through Team 2. And so Team 2 kind of works as it shows on intervention development, testing, and training. And one of the key hubs and resources that we've been building is called a motivational interviewing hub. And so there's a team of interdisciplinary researchers that run different projects through Team 2. So it's myself, Lorraine Lanningham-Foster, Allison Phillips, Laura Ellingson, Jacob Meyer, and we have 2 grad students, Katie Southern, Katie Deshaw, and also Maren Wolf, a former doc student that's now a postdoc. So we have this team that's been really working together to bring this training capacity of how to train people in motivational interviewing and health coaching, and then how do we use that to build stronger partnerships in the community. And so then that's what led us to connect with Trina Suchan, and so she's our guest speaker today. But I wanted to take you on, you can scroll down, keep going, Quinn. So these are some of the interdisciplinary projects within Team 2. So we've actually just formed a really nice partnership with Trina and Community Health Partners. She's still scrolling on this program called Walk with Ease. And Trina will tell you all about Walk with Ease, but one of the key needs is to train a cadre of health coaches that can provide motivational interviewing for people in different community settings, not just in Ames, but across Iowa. And so we're really excited about that partnership and what we're doing. But one of the key facets of this is, again, the motivational interviewing hub. So now we can go back to Team 2 and click on the MI Hub. So what we're trying to do with the MI Hub is provide a training model for how to train students in motivational interviewing. Go to the top.
Is that the top?
Down. There, now click on the MI Hub page. So one of the other key themes during this spring set of talks is each of the talks, the one in February is going to highlight one of the resources that's managed by this team of researchers. So that's the Motivational Interviewing Hub. In March, then we're going to highlight collaborations with Team 4 that are managing another resource called GivePulse. That's a community engagement service learning hub. Then in April, we're going to be highlighting collaborative work by Team 3 that's working on this other resource tool called Pillar. And so all of these are resources that we're making available through U-TuRN, but that are coordinated by different teams of faculty that all are connected to U-TuRN in some way. So I just wanted to highlight that the theme again this spring is these collaborative teams and the resources we're managing, as well as these community partners. So you guys can explore these links later, but I think what I'd like to do now is introduce Trina and have her come up and share what she does with community health partners and what Walk With Ease program is, and she'll take it from here, and there'll be probably time for questions at the end.
Okay. Are you going to be changing my slides?
Yeah, you can do it just left and right.
Left and, I think I can handle left and right.
All right.
All right, well, thank you so much for having community health partners here today. I just want to kind of just recognize two people that are part of community health partners. We have John Garnis, if you want to raise your hand. He's president and CEO of community health partners, or I'll say CHP, which is what we go by. And then Scott Suchan is the mayor of Clive, and he's part of our team as well. So if there's questions, I might be pointing at them. All right. So just to let you know, my background, I'm actually an alum. I graduated from Iowa State University a while ago, and then I went to University of Iowa for PT school. So my background is a physical therapist, and I've been involved in wellness for as part of physical therapy for many years. Been kind of doing medical-based fitness for about 13 years now, so we'll kind of talk a little bit about that. But I thought, since most of you probably don't know CHP, we would just start with a little bit of history. I'll be pretty brief on this, but it might give you some perspective of where we're coming from. So it began in development. John, his background is a developer, and he's developed over 3 million square feet of medical office, professional office, hospitality, mixed-use properties across the U.S. So basically, he has done a lot of, and who would say this, the traditional sick care model, building hospitals and physician clinics and surgery centers and so forth, really partnering with physicians and those hospital administrators and trying to find the best way to deliver patient care through the environment. And so he's done that for a number of years. I won't say John how many years, but a number of years. And then he had the opportunity back in probably, John and I started kind of down this walk in 2006, so it must have been 4 or 5 prior to that, where he had the opportunity to maybe try something different. And there was a land available where he had been working with Mercy Medical Center, and he had just helped develop this neighborhood or the land just across the street from it, the hospital there, Mercy's Hospital in West Des Moines Road, Clive. And then surgery centers and so forth. But this was an opportunity to do something different. And so, make a long story short, they came up with the idea of a wellness campus. And it was a partnership with Mercy Medical. And then they started looking at creating a hub within this campus called a Healthy Living Center. And so that's kind of when I joined the force with John around 2006, because I had been doing medical-based fitness for a long time. So kind of brought that model to the table. And then, again, long story short, John also brought the YMCA. And so it became a YMCA Healthy Living Center in 2009. And it was really geared towards treatment for chronic disease, treatment, wellness, really addressing chronic disease in our community. So it was the first time this YMCA had ever employed physical therapists nationally. And so this became a model for YMCAs across the U.S. as well. We would have hundreds of YMCAs and their hospital partners come and visit our location because we were doing something different than some of the numbers that were coming out of your traditional medical fitness association or facilities. We grew to about 8,300 members, and about 50% of those were referred by a medical provider. So those are some numbers that are higher than most medical fitness association facilities or medical-based fitness facilities. So that was what was attracting a lot of attention as well. So about 50% were there through a provider-driven referral. And we had about 1,160 plus individual providers referring to the YMCA Healthy Living Center, not just from Mercy. We had that partnership with Mercy, but it was also YMCA, which is neutral ground. And about 30 to 35%, I think, at peak was from Mercy referrals. All the rest was from our entire community across all healthcare organizations and even coming from Ames, coming from the Mayo Clinic, coming as far as Oskaloosa, and we were really pulling from a lot of different places. We had over 20 plus evidence-based chronic disease programs alongside traditional membership the YMCA would provide. And these were some of them, specifically licensed, evidence-based, the top tier, tier 3, and I think now we're going to tier 4, evidence-based programs that we were finding our community had the needs for. So it was cancer, it was heart, it was pain, it was neuro, falls prevention, and so forth. And we had consulted with a lot of different partners. As they would come in, John really orchestrated this, and Scott may have been a part of some of those, and people were coming in to look at this model and learn from it. And so hopefully we were giving them some good advice. Okay, so then in 2017, we had the opportunity to create community health partners. So Mercy and the Y kind of split their partnership. They went up different ways. The YMCA continues to flourish in the Des Moines and central Iowa locations. And then Mercy did continue this medical-based fitness, and so is doing that on their own in that facility. So things are still moving forward there, and that just gave us the opportunity to say, okay, where can we best help, promote and sustain this type of model? And so we created community health partners. And CHP is dedicated to the design, development, delivery, and support of health and wellness environments. So we can build environments, we can develop environments, and we can help with deliveries of environments. We can also work within Wellness Without Walls, so we can work within YMCAs and community centers and churches as well. Basically, I want to say we don't want to duplicate services, we just want to enhance the community. So if we have a partnership in Huxley, and we're working with the physician there in that community center, and we always go in with what is going on now, how can we support that and lift that up, and then just fill some gaps. And so that's kind of our approach. And that, again, that could be providing or designing and developing facilities as well. So in 2018, this was really chiefed by Scott and John, and Scott, so Trina has really taken this and is leading this area for us, developing a Healthy Living Center foundation that has become now not-for-profit, because we also see opportunities that we can have a greater impact if we can go work towards having an arm or a relationship with a nonprofit just to help with accepting grants, bringing benevolent donors to the table to support these type of models and support patients who don't have the means to be able to maybe afford some of these programs and services out there. So a lot of opportunity here, and we're exploring that, and that really supports our community health initiatives that we'll hear in just a second. And if you want to learn more, I know John and Scott will be here to have conversations after about all that. So just brief here. So again, environments, develop, own, manage environments, function to create healthier communities. We don't always have to own. A multidisciplinary team of medical fitness professionals. So our people are physical therapists, they are nurses, they're dietitians, they're health coaches, they're medical fitness professionals. And we have oversight from physicians as well. Programming, we do collaborate with partnerships to provide programs and services so that we really, again, I stress that we collaborate with partners to provide programs, so it's not just us bringing a program to a location. We collaborate with what's going on there. If they're already doing a program, how do we enhance it? Or can we bring something together to a need in a community? Technology, comprehensive IT platform. We are working on further customizing this for the various needs that we're finding for data collection and reporting that can integrate with EMR systems, produce analytics, tracking, and reporting. Because that's really important to make sure that we are talking about this great model and we have all these great testimonials, but as you know, we need the data. which is another great reason that we are partnering with Iowa State with their abilities for that evaluation and that data collection, and really strengthening our approach in this model. So community focused, partner with a wide range of community-based organizations and so forth. Just a few of our pictures here. This is just some of our healthy living centers and some of the programs that we do. Up in the first picture here in the corner, upper left corner, that's our FAS bike. This is something that we feel really strongly about, opening up opportunities for those that may not be able to get onto and off and utilize the equipment, the traditional equipment out there. Having a functional electrical stimulation bike that can be connected to an individual that has significant weaknesses can then join in where everybody else is and participate in wellness within a community, versus maybe being doing some of this in closed doors in a clinic. We really want them to experience that community. So this is an important piece of what we do. The two pictures that you see in the two catty corner is from our Liberty project that we have done with in partnership with Liberty Hospital. Just a few of the pictures there, and then nurse navigation is very important to us. And all those other things that we bring to the table when we're looking at environments and healthy living centers or community centers and so forth. So why we're here today specifically, we're really excited about our partnership with Iowa State University here, and integrating some of the work that we're doing with their health coaching programming. We see that the health coaching programming at Iowa State, obviously it's based on research, it's foundational, and we want to be a part of that. We want to create health coaches that can go into communities that are linked to, again, evidence-based training and education that comes from a strong academic institution like Iowa State, and I believe DMU is going to also be a part of that as well, so I'm very excited about it. But we believe strongly that to help individuals become more engaged and involved, we need to change the conversations we're having with our patients, clients, and our providers. CHP has made a commitment to advance education and training on the process of behavior change, and so that's why we're partnering here today. And we're pleased, and I said that already, we're pleased to partner with Iowa State. So where do we begin? Here are opportunities that we see where we want health coaching to be a big part of. Some of the work we're doing in the community, and then where we see opportunities for collaboration and for opportunities for students also to get training as well. So we, and then again, Scott Suchan is the mayor here, and John happens to be the president of the Clive Community Foundation. So these guys were the initiators of this Clive Community Health and Wellness Initiative. They wanted to make a difference in Clive, and we like Clive because it's just big enough to really test interventions and do this work, and then maybe take them to other communities. But we have 100% of the city involved and very active in this, the Clive Community Foundation, obviously, and then we have a lot of leaders that are involved in this. So Clive Community Health and Wellness, it's really the mission, again, came from John, the Clive Community Foundation, and from the city of Scott to address obesity, inactivity, and poor nutrition in our community by making healthy behaviors, healthy lifestyles, shared community values by educating, engaging, empowering, and supporting residents, employers, and employees. So that's our mission. They also worked on creating a structure that, one, will help with sustainability, but even more importantly, for engagement. So there's, we always, the tendency for health initiatives, community health initiatives, to come from the top, where you've got this top kind of layer of individuals that are very innovative thinkers and develop all these programs, but then it trickles down and gets lost. There's not enough engagement, there's not enough buy-in. So we decided to make this a priority of engagement. And this structure really, really enhances that opportunity that we have. So you have a visioning task force, which are leaders in the community that are there to throw ideas to, or report to, so they can continue to promote within their organizations and within the community. And then we designed three task forces. We have a design task force, and the way I look at that is they are experts in our community. They are ambassadors for the community, and they really want to get involved. And so we have, within these task forces, we have 3 tracks. And we had, when we first started, I should give this history a little bit, when we first started, there was 4 tracks. And then, again, long story short, John, I'm going to skip a few of those things, but we became partners with Healthy Hometown, which is a product of Walmart. So they got wind of what we were doing, we had some talks, and we decided to embrace their 3 tracks because it really meshed well, blended well with what we were doing. So we had nutrition and diet, they said that's eat well. So we have an eat well track. Physical activity matches with move more, so we have our move more track. And then our intellectual, emotional, mental, sleep, that matched really well with our feel better. So we have those 3 tracks. So the design task force works on designing programs, analyzing the environment for community needs, testing tactics, built environments, looking at all evidence-based programs locally, nationally, and statewide. So they come up with the interventions. They even look at, okay, how are we going to measure those things? And then it goes down to a developmental kind of task force, which could be people from the design task force who want to take a deeper dive in certain areas. Maybe they're super passionate about something, like community gardens, which we've done. So they wanted to take a deeper dive into that. But then we want to reach out. Here's the engagement part. Now we're going to reach out to another layer of people within the community. And those are your champions. We call these our neighborhood champions. It could be businesses. It could be community centers, it could be just someone in the community that's a real champion on something. So these are our neighborhood champions that want to schools. They want to take deeper dives. And they test those programs, tactics, built environments. They test that in the environment. And then the delivery task forces, now we're getting down to the individual level. And I think this is where a lot of things get lost at times. But if we can engage our individuals that live within our neighborhoods, so as you see, also, we have the wilds, the headwaters, the lakes. These City of Clive was broken down into these 5 neighborhoods. It was actually part of a project with the Greenbelt Trail. And so we utilized how they broke that down. And what was really nice about this is we can be precise in the way we deliver some of these interventions per what's going on in that neighborhood. Is it different culture? Is it different language? Is there distance? Is it rural? Is it, we can really be precise in how we deliver that when we can kind of narrow down those neighborhoods a little bit more and focus that in. And so the delivery task force is really boots on the ground. We call them coaches, health coaches, right? And that's where we see opportunity with Iowa State in helping us with getting maybe some opportunities for coaching at that individual level, boots on the ground, getting people engaged in the programs, tactics, interventions that are being developed. Okay, that was a long story long, probably. Engagement model. So basically, community ambassadors work on population health approach. But we move all the way through neighborhood champions to neighborhood health coaches for that individualized personal approach. So we see opportunities here for health coaching. Here's a program that we've been talking with Dr. Welk on. They have the SWITCH program here with Iowa State, and we see that this would be something that we can work on and bring to the schools in the Clive community. We have 3 schools in the Clive community. And so what we're looking at doing is possibly having a foundation looking at seeing how we can fund or support the SWITCH program, which is a support service in itself to the schools. They don't tell you, or they don't come with all these programs and tell the schools what to do. They say, what are you doing and how can we help you with that? How can we help you with measuring and evaluating and getting data? So we see this as a really a great opportunity for us to bring some support and resources to our schools. It fits our Eat Well track by our Objective 1.2 to provide evidence-based programming opportunities for nutrition education. We see it fit Move More, and we see it fit in our Feel Better tracks as well. Then we're working on childhood obesity. So we have had the opportunity to work with a physician, Dr. Gross. I'm sure some of you guys may know her, Dr. Jennifer Gross. She kind of champions for the state of Iowa obesity strategies. She's on the obesity statewide strategy team or task force team, and she's also part of the American Academy of Pediatrics, and I believe she was the Iowa chapter president just shortly ago. But she received a grant through the CATCH program, which some of you may be familiar with, but it's not the CATCH program at all. It's just through that organization. It's a national initiative for pediatricians to lead innovative community-based initiatives. And so they connected with CHP because we had been doing work with them, and they talked about, we don't have enough childhood obesity programs out there, and we don't have physicians that know about them, and we don't have a good referral source or network to refer patients into them, and we don't have data that's coming back to us to make this all work. So we have partnered with them to get all of that kind of organized, and we're going to pilot that through the YMCA of Greater Des Moines to start, because they have those 8 locations within Central Iowa, but our goal is to take that outside of Central Iowa and bring it to other communities as well. The program specifically we're looking at is ACT. It's for 12 weeks. It's a program already being done in Seattle WISE and having a lot of success. But again, we're looking to incorporate Switch and seeing how Switch can also in this area help with that ACT program and helping the WISE, not just schools, so now we're bringing Switch to the WISE potentially to see how they can help and support that program being spread across the state. And just to let you know, we have 55 YMCAs through the, actually I think a couple have dropped, so between 50 and 55 YMCAs throughout the state of Iowa. And it's pretty well spread. Cancer survivorship, I'm actually working with Allison Phillips, right, Dr. Phillips? And so this is where we're working with her on is, so we are a partner of Above and Beyond Cancer. How many people have heard of Above and Beyond Cancer? It's a great program. It's a great group of people providing opportunities for cancer survivors to continue wellness in their survivorship. And so we partnered with them to enhance what they're doing, again, and to connect them with other opportunities. So cancer survivors are referred to CHP and onboarded into the YMCA by our nurse navigator. Our cancer survivors are introduced to programs and services, such again as health coaching. So I always bring that up as opportunities for health coaching that address holistic health from all stages of survivorship. CHP, Above and Beyond Cancer, are working, I said it there, Dr. Phillips, to identify the universal behavior-specific processes and mechanisms of health habit development in cancer survivors. So that's the work we're already starting with her. We've been working with Above and Beyond Cancer for a while now. The WISE give 12 weeks free to all cancer survivors, and so that kind of starts their process, and we connect them with coaches. Other ones, Save Your Brain. This is a program to help address increasing rates of cognitive decline and dementia in society. This program helps individuals adopt healthy lifestyles that not only reduce the cognitive deficits and dementia, but also their wellness and overall wellness. We're doing this with partnership with Broadlawn, so Dr. Yogi Shah and Dr. Patricia Pinlisk, who was the state epidemiologist here in Iowa. It's really their program, but they're looking, which they've done at Broadlawns, but they're now looking at how do we get this program statewide, and came to CHP to look for help on that. And so we are again bringing them to the Y to start, but we definitely want to take this across the state too if there's not already something going on. But it's another opportunity because they use health coaches to actually deliver the curriculum. So again, more opportunities for health coaches to be a big part of something that's as impactful as what I've just told you about so far: cancer survivorship, childhood obesity, and now Save Your Brain, and other things, but that's what we've been talking about. Okay, landing finally on Walk with Ease. So the NACDD, and that's the National Association of Chronic Disease Directors, And thank you, Quinn. He's going to be passing out our flyer. This is our last year's flyer, so our year 2 of the grant that we received. This year we're looking at modifying it and bringing in other partners. But the NACDD improves the health of the public by strengthening state-based leadership. We, CHP, received a grant that we are funded to be the Walk With These hub for the state of Iowa, for really, truly expanding the Walk With These throughout the state. And there's, which I'll talk about in a minute. So grantees work to coordinate partner networks. I tell you, it's a big number of the amount of people we got to get through this program. And it's 3,000 people by the end of September of 2019. And you know CHP cannot do that alone. So we are looking at partnering and collaborating with a lot of organizations. I'm looking at Tracy Porter right now with just thinking Iowa Physical Therapy Association, obviously the WAC, there's more. We're partnering with Arthritis Foundation, the Iowa chapter. It is their program that they developed, the National Arthritis Foundation developed it in 1997. ISU is a big part of this. Iowa Department of Public Health, Applied Community Health Initiative will be, it's one of our signature programs that we're going to be spreading. YMCA's AAA's Million Hearts, we're going to be integrating it into state health initiatives at this time. So Million Hearts, UPP, Iowa's Falls Prevention Program, and so forth. So you can see a lot of ways we're going to get partners involved. What is the program? The Arthritis Foundation developed it to encourage people with arthritis to start working to better manage the pain. That's how it was founded, that's how it was developed. And it's really effective. You'll see the research in a second. But more and more chronic disease associations and providers are looking at this as a really great program to get beginners. So individuals with health risks or chronic disease, so we're looking at getting our diabetes populations involved, cancer populations involved, sedentary individuals, so that beginner to start exercising. This was a great program to do that. Individuals who are just interested in weight management, and individuals who might be walking now, but they're walking by themselves and want to get connected to a group. So there are 2 versions of the program, group walking and self-directed. And the only criteria that is required for someone to be able to participate is that they can tolerate standing for 10 minutes. And then the other reason why I really like the IPTA, the Iowa Physical Therapy Association, being involved is because if someone cannot do that, this is where physical therapists all across our state can step up and really get that person to where they can tolerate that and be an active and successful participant in the program. Here's the research. They have done a lot of research. It's the tier 3 level of evidence-based, so it's up there. CDC recommends it as a program for many different reasons, but pain management and so forth. But what I'd like to just, what's so interesting to me is the outcomes. They found no difference in group versus self-directed formats at 6 weeks. They all decreased pain, stiffness, fatigue, decreased disability, increased strength and balance, and walking pace. But after a year, self-directed participants were seen to have more sustained benefits. So I know the opportunities we have with Iowa State is to look at that even more closely. So these are things that we're going to be working on together with Iowa State. But the Walk With These group program, so it's six weeks if you do it 3 times a week. It's 9 weeks if you do it twice a week. The goal is 18 sessions. Groups of up to 15. The curriculum is pretty much spelled out. They even have a book, leader guide book, that kind of scripts what you work on that day or that session. Classes always begin with about 10 minutes of education. There's, and again, it's scripted. You have examples of what you would be talking about, but you also have room to be flexible and bring in your own resources or people in the community to talk about those things. They go through stretching and strengthening as a group, and then there's about 10 to 35 minutes of walking. And the participants receive guidebooks, educational materials, and instructors are Walk With These certified. So one of my efforts is to spread the Walk With These group program around the state. So first of all, today, if anybody's hearing this and would like a Walk With These program going on in their community, then they would connect with myself and we will provide the tools The grant covers your certification costs. It's like $89 online training, but we really support you to get a successful Walk with Ease program going in your location or your area. Then the self-directed, which, and I should say, and with Iowa State, they have already some strong walking programs and connections going on, and working with McFarland Clinic on some things. So excited to help them, integrate the Walk with Ease program into those efforts, and we'll do that and support them how we can. So the Walk with Ease self-directed, basically, this is something that we are going. We're kind of going off course a little bit than what is prescribed by the Walk with Ease program right now. Right now, if someone is interested in getting going on a walking program and they want to do it by themselves, they're given a guidebook. How successful do you think that's going to turn out? Right? And even NACDD is like, so what they found then, so the Osteoarthritis Alliance Network said, we're going to give all our grantees just generalized emails that they can push out to these individuals and keep them engaged during the 6 weeks. Well, we said we want to take this a little further. We believe in health coaching, and we now have a partner that believes in health coaching as much as we do, or more, because we're putting a lot of time and effort into it. And we believe we're going to have much better outcomes if we could assign a health coach that connects with the person once a week for the 6 weeks they're in it, and really helps guide them through it, through motivational interviewing, through going through 5 stages of change, and really individualizing that kind of approach and ensuring that they're successful at the end completing the program. Not just that, which is where I get the credit, because we get, that's 1 towards 3,000, but it's more than that. We want these health coaches to help them with a plan afterwards. What's next? So that's where we really believe in that success. So with Iowa State, we're working on getting our students involved. So the students are going to be our coaches. One matches greatly with, and we'll talk more about it if you want to learn more, but it greatly matches up with their curriculum and their programming. So we're really excited to be partnering for those things and providing people across Iowa a coach for those 6 weeks. And so, again, just building opportunities to impact community health is what we're interested in. Some of those pictures were from our YMCA Healthy Living Center. But we are, again, we are excited about this Walk with Ease opportunity. Could go into a lot more detail, and I'll be open to questions, or I don't know how we're doing in time, or talking in groups afterwards. But I would love to really gain more partners in this effort, and let's get Iowa at the top so that this NACDD and the CDC will continue to fund programs like this for the state of Iowa, because we have all these partners that rally around these efforts for chronic disease.
The grantee on this again?
CHP, Community Health Partners.
Okay.
So let's thank Trina.
Yeah.
People can ask questions.
Okay.
We'll keep whatever we got.
Do you have any other questions about any of our programs? Or do you want to give any more of what we talked about today? Any more information?
For the city of Clyde, I'm interested in how you got momentum to keep this going, because in our community, we've been talking about things like this for many, many years. So how did you keep the momentum and actually make it something?
That's a great question. Thanks. So that's a great question. John has mentioned this, and I think Trina's mentioned this. It's all about collaborations and relationships. We saw from the city of Clyde perspective that, we're not I'm going to give a little bit of history here, hopefully to kind of look us back to what we're talking about. We're a landlocked community. There are certain things that we do really well. We don't have a lot of commercial growth. Really, our growth is in nice residential neighborhoods. And so when we took a reflection about what do we do really well in the community of Clyde, it's about raising families, providing health and wellness opportunities for all of our residents, visitors, and employees. So we decided that was something we really wanted to focus on. We knew that we have lots of stakeholders throughout the community, at the professional level and the individual level. They really have a passion about health and wellness. And health and wellness is across the board. We, from a community perspective, it's our built environment, it's our programming, it's our trail system, our park system, our programming through our library system. All of those things are designed to lift up people, children, adults, senior citizens, you name it, across the board. And so we knew this was there. And this hasn't happened overnight. I mean, Trina presented kind of a history of how does this kind of come to be. John and I really became involved together probably 5 years ago because we saw that there was a way to do this, to pull all these stakeholders together under an initiative and make it kind of a Switzerland. Okay? And the city being kind of one of the members with a seat at the table, but one of many. And so I think as we started to pull this together and talk to people about the initiative, about the importance of it, what it means, what we could do with it, and other people. And so we're really now with CHP really making the investments in people. Here's a big investment. Just kind of a loan executive, United Way loan executive model, we'll call it that. Because it's all about facilitating and programs. And really got to have some way, some person or several people before we work to do that. To pull these strategic partnerships together. So from a city perspective, we're one of those strategic partners. And so as mayor of the city of Atlanta, it's like, wow, we can get some traction with this and really plug it into everything that we're already doing from a kind of the community built perspective and get it down to our neighborhoods. Trina showed the neighborhoods as part of our Clive Greenbelt study. Different socioeconomic situations, different makeups for each of these individual neighborhoods, all based on different attributes of Walnut Creek that runs through the length of our community. Kind of catchy, kind of cool. You start to kind of pull all that together. And so I don't know if that's necessarily specifically answering your question. It's not a one or two sentence answer. It's a whole bunch of factors that really come together. It's about a critical core of people in leadership that have the resources or can find the resources to give it traction. So great question, thank you.
Is that task force image out on the website somewhere?
I don't know if it's on the I don't know if it's on the website, but we can get it to you. Yeah. I'm just going to kind of tag on as Trina knows I'm going to talk. Oh, I'm sorry. The feel like I'm voice. There are a couple of things, so we can get that to you or whatever. But as far as the community goes, one of the things I think we saw is the opportunity to get this initiated in Clive through our foundation. So we have a Clive Community Foundation, and that community foundation has 3 pillars: quality of life, community health, and collaborations. So as we got the wind under our wings as a community foundation, and we started our grant cycles, and we started our endowment fund, and we started looking at how can we make it bigger as a foundation. And then with our pillars, it really brought us to that opportunity to start thinking about the community and where are your resources within your community. And the word engagement was mentioned 2 or 3 times. So it's engagement at all levels. When I say levels, it's not top down or down up or whatever, but the opportunity is to find your resources in your community, find the pharmacists, find the providers, find the people that are working in the area of public health, find just your neighborhood leadership, go into your faith-based community, and bring those people into these task forces. Identify holistic health, mental health, cognitive, physical, and diet and nutrition. And so build a platform for holistic health engage your community. And then as this matrix reference, your goal is to hit that person and ignite that spirit, light the pilot for that person that is not engaged. And find that person where he or she, where they live, and encourage them, invite them, support them with health coaching, either telephonic or direct. But your word and your mission is engaging. And I think it's somewhat generic with those resources that you can pull together as a community. You sit back and reflect on your community, the different, as our neighborhoods in Clive. I mean, we have an interesting socioeconomic difference from east to west in Clive. Our age demographic, from the kind of Windsor Heights border to our Waukee border, homeowners, renters, and so forth. But bring those people into an engagement model. So that's my 2 cents.
I just had a quick comment to that. Or to come back to your question specifically about the matrix, if you will. It's a great matrix, but it's an eye chart. Okay, so we've got to work to simplify that a little bit. But I just wanted to add some color to the matrix. So it's key leaders in the community, at a higher level, that come together, that brainstorm ideas, that work then ultimately with this design. Eat well, move more, and feel better. So you can start to see in this not necessarily a pyramid, but in this matrix that people across the spectrum of the community are involved at each level, in each track, all the way down to individuals and neighborhoods, health coaches. That's our optimal state. That's really what we want to do. Then throw in the community and our investments. Then throw in employers and employees and their investments and how we can alongside those interested stakeholders to improve the quality of life of their employees. And then really as a community, our visitors, those people that are coming in, how do we plug into that through our hotel and motel operations? How do we plug into schools? How do we plug into these areas? So as you can see, this is a big, broad spectrum of individuals and organizations that are touching this mission concept. As I've talked to people, told them about what we're doing, they're all like, yeah, but nobody's been able to do it. Right? So it's back to your question. And well, we can do this, but how do you know, right? One bite at a time. And so we're doing that, and now starting to see some real initiatives come out of this group. By the way, this is an ongoing process, right? So you don't just bring everybody together, brainstorm ideas, come up with initiatives, deliver them, and stop. We start that process all over again. And hopefully, if we're doing our jobs well, we're bringing more and more people to the table to help determine priorities and what's next in each of the areas, being moving forward, feeling better. So we're going to get back to that matrix and make that simpler. Looks pretty good, but we want to simplify that a little bit. And really something that we can take to another community and say, hey, by the way, we can help you do this. And let's individualize it to what you want to see happen in your community. But I think community leadership is a big part of that.
And that was just the some of the impetus, and really the genesis for us to create a foundation, the Healthy Living Community Foundation. Take the Healthy Living Community Foundation and take this matrix for self-directed health and well-being with a supportive engagement model in your community.